Here are 5 things that you need to consider before your fibroid surgery. Number 1, make sure that you're consulting with a specialist. Seek consultation from a fibroid specialist or a gynecologist to thoroughly discuss all the options that are available and make sure that you're aware of the risks and the benefits of surgery. And make sure that you understand the actual surgery that you're having, the very specific surgery that you're having. There are different types of fibroid surgery that are performed, so understand the risks that are pertaining to your surgery. The main risks can be bleeding, infection, damage to the surrounding structures such as the bladder, and also anesthetic-related issues. Make sure that you discuss these with your surgeon and also understand how likely this is to happen. Most surgeons will go through all the risks, but I think everybody is different too. But in understanding what that risk actually looks like, how likely is it, is important too. Hearing risks without understanding how likely they are can sound really, really scary. So make sure that they try and put that into perspective for you. Make sure that you are in the best possible health before the surgery. Make sure that you follow all the doctor's instructions. Sometimes you'll need to have swabs before to check for MRSA, for example. You might need to have blood tests. You may need to have ECG. Try and get these done in a timely manner. Make sure that you are informing the specialist of any medications that you're on and any lifestyle changes as well, such as making sure that you are eating as well as you can and exercising too. If you are a smoker, try and cut down and try preferably to stop. I know that might be a little bit tricky, but cutting down is going to have huge benefits for you. You also want to discuss the various surgical approaches with your doctor, such as myomectomy, which is just removing the fibroids while preserving the uterus or the womb. Or is it a hysterectomy where they remove the womb entirely or the uterus? Consider the implications of each procedure on your fertility and also your overall health. Everyone's individual situation is unique, so it's really important that we have an open discussion and communicate thoroughly with your healthcare providers so that specific decisions can be made for your case. Understand what the post-operative recovery looks like. Usually it can be 6 to 8 weeks, sometimes longer. So make sure that you have arrangements with work. Do you need to have a sick note that's provided by the hospital or by the specialist or by your own GP? Ensure that you might have additional help at home with daily chores or with childcare as well. Be sure to try and mobilize, keep walking, keep active, and be on top of your pain relief too.